welcome to my vlog. Today we are talking about the knees. This is all about the knees, and my goodness, they can cause some problems, can't they? It was about 20 plus actually 20 plus years ago, I couldn't actually sit like this because I got a knee injury when I was a professional dancer, and that was the end of my career. Heartbreaking, as anyone out there who has danced or moved in any way knows. When you get an injury that stops you doing what you love, it's devastating. But look at me now, here I am sitting with my knees crossed. I still have the injury, but because I've done a lot of rehabilitation work through Pilates exercises, I'm able to sit like this with no discomfort at all. So it just goes to show the power of Pilates. But today, anyway, I'm going to talk about the knees. So what I've noticed with the channel is that as it started to grow, certain things have come up time and time again that people want to know about, and one of those is exercises for the knees. So I'm just going to talk a little bit about that today. Obviously, if you have any issues at all with your knees and you're really concerned, it's not just a little bit achy here and there, it's something that's ongoing, continual, then do go and see either your doctor or your physio, your physical therapist, because they are the experts. They can give you a medical diagnosis and sort out suitable treatment. Okay, so I'm coming at this from the Pilates perspective. So this will be exercise focused, and I'm going to talk about the conditions that come up quite often and ways that you can manage it. So probably the biggest one will be knee arthritis. Now, knee arthritis is not necessarily for somebody who is in their 70s or 80s. It's a lot more common then, but I have worked with people who've got really severe knee arthritis who are in their 40s, and that is really, really tough. So arthritis, osteoarthritis, is very, very painful, and what you will see if it's something that you have or you've developed or you know someone who has it, you'll see that the leg starts to change shape, and also the person will often change their gait, the way they walk, the way they stand, because of the pain and the discomfort. And of course, what happens with that is completely understandable, but that causes other issues in the body. So when you're working with knee arthritis, things to think about is trying to do exercises that will work your knee, that will keep your knee in as correct an alignment as possible, because we want to strengthen all the muscles around the knee without wearing out the joints. So that means we want to work kind of the feet, the ankles, the calf muscles, the thigh muscles, the muscles at the back, or the hamstring muscles, the glutes, the hip muscles, and the core. You need a combination of all of that to really help you with the knee, because often a knee arthritis is wear and tear based, but it will become more exaggerated if someone's always had a tendency to kind of put more weight on one side of the body than the other. That's when it kind of starts to show. So I've seen people, and I've worked with people who have quite severe knee arthritis, and in one case, one lady, her knees from her legs from the front, if you imagine that's just kind of a straight leg, sorry, that's a straight leg that way, her knees went completely in like that. So her thigh bone would come down to here, her knees would be in and her feet would be out, and that was the knees collapsing inwards. So with her, what I had to do was work at really strengthening the muscles on the outside of the leg without putting the knee under any strain. And equally, I've seen and I know people who've got knee arthritis and their legs go the other way. So instead of the knees coming in, the legs are starting to go out, or one side the leg is going out. all this obviously is a sign that the muscles are getting weaker on one side of the leg, and also that the knee is not coping very well anymore and it needs help. So I've done 2 workouts for the knees, and the first one I've done is a chair-based workout. So I'm going to flash up a card for you just above my head in a minute, and that is for you to click onto if you want to go straight ahead and do the chair workout. So the chair workout is for people who really don't want to put tons and tons of weight on their knee, but they know that they are at a point where their arthritis is pretty bad. You may be leading up to having a knee replacement, and you want to get those muscles a little bit stronger without the severe pain on the knees. So that's why I've done the chair-based workout. So I would recommend that for anyone who's at that stage with their arthritis. And if you're getting achy knees but they're still okay, but they do ache, and you feel it's an age-related condition, it's wear and tear related, then I've also got a mat workout, which is a tougher workout in some ways, but it's all on the floor. All right, so that one I'm going to flash up the card for you now, and that one you can go ahead and click on if you want to just get started. If you want to hear a bit more about the knees, I shall talk for a little bit longer. So we've done knee arthritis, and then there are other things that come into it. So if you're someone that does a lot of running, you might be getting pain in your knees, and that could be to do with the knee tracking. So there's a patellofemoral syndrome, which is where your knee is not really in alignment and there's a lot of rubbing on the knee. So for you as well, I mean for everyone with knee issues, both the videos I've done are going to be suitable because they really focus on alignment and working the knees in correct alignment, which is really, really important, but also rebalancing the muscles of the body. Often with someone who runs, they're stronger on the front than on the back, so they have to work more on the back of the legs. Often they might not have the strength on the inner and outer thighs. So the workouts I've done will work the leg all the way around, as well as the core, the hips, etc., etc. So what other things are there? Well, there's meniscus tear. Meniscus tear, that's what I had. And the meniscus tear, you've got 2 menisci, I think is the name for 2, inside your knee. And these are like the little shock absorbers that kind of sit behind the kneecap. And they're a crescent-shaped cartilage. And what can happen is, under duress, they can tear. And what sometimes happens is little bits tear off and they're floating around in the knee, and it's really, really uncomfortable. And obviously this is a kind of shock absorber for the knee. So when that tears, it can be very, very, very painful. And again, you know, you must go and see a doctor if you've got pain in your knees. But the workout that I provided, either the lying mat workout or the sitting one, again will be very, very good for you. There's obviously people who have had a knee replacement. Now, if you've had a knee replacement and you're watching this, you've probably already been given the exercises that are right for you to do. But if you're down the line from that and you're sort of well into your recovery and your knees moving and you're feeling okay, again, you can do either of the exercises that I suggested. All right, so that's just to give you a kind of an idea of things. There's lots and lots of things that can go on with the knees, but the main things that I always recommend if you've got problems with the knees and you want to exercise is to avoid really heavy loading on the knees. Okay, so not kind of having a weight across your shoulders and doing, you know, knee bends. That's not a good idea. The other thing is you don't want to bend the knees past a 90-degree angle, because that's an excessive kind of pressure on the knee joints. There's a couple of other things I didn't mention. You can get, there are ligaments inside the knees that can also tear. So there's the ACL, anterior cruciate ligament, that can often tear. Lots of footballers get that. Footballers and rugby players get that injury. That's not nice. It's often when you've had an impact from one side or the other, or you've had a a sudden twist in the knee. And again, these are all things that you should be seeing an expert medical professional about. So, you know, I'm a Pilates professional, I'm not an expert at medical conditions, so you must go and see someone if you're concerned. But the basic premise for any knee related work is look at the tracking of your knees. Don't overload the knees with heavy weights. You want to do a lot of what they call open chain exercises. So open chain is when there's no weight on the bottom of the foot. So, you know, if this is my leg, oh, let's get my legs out. If you're going to do a leg extension, for example, you're extending the leg. This is open chain. There's no pressure on the leg. I'm just moving the leg in the air. All right, those sorts of exercises are great for the knees, and lots of those are in my workouts. So I hope this little vlog helped you. Obviously, if you want to know more, do go and see your doctor or physical therapist. If you feel you kind of understand everything, you'd like to get started on the exercises, I'm going to put them at the end of this video as well. All right, so I hope that helped. Have a fabulous day. Thanks for watching, and I'll see you soon.